years ago, when I was a young spine surgeon, we'd see, so back in the late 80s, when I practiced in 1986, you'd see some of these patients would have not 1886, 1986, okay? Anyway, you'd see some of these patients would have a degenerative spondylolisthesis, have laminectomy, and then it would fall forward more or fall off. They'd have horrible troubles. So then it got to be that they were all going to need spinal fusions. Laminectomy and spinal fusion. So there was a lot of controversy. Then there was this SPORT study, S-P-O-R-T, and that kind of came down as like, well, they should be a laminectomy and a fusion with or without instrumentation. So basically, starting around 2000, you came in with a problem like this. You got a laminectomy, fusion, rods and screws, and maybe a cage. Patients improved. Patients did improve.
Mm-hmm.
Okay, so now, fast forward 2025, we have new technologies, and people are starting to rethink, should we do a fusion? Do all these need to be fused? And I think increasing evidence comes out that, no, if they're really stable, they probably don't need. So now this fella has horrible sciatica. He's used to living with a backache. He's had a backache for 20, 25 years. His backache's not the problem. He runs and jumps and golfs and swims, bikes, backache, not a problem. Sciatica is what's killing him. He wants to get rid of his sciatica. If he can get rid of his backache also, that's great, but he can get rid of my sciatica so I can go back to do what I do. So what we did was a transforaminal endoscopic decompression, little incision, this big, 35, 40 minutes in there, drill it out, and he's all better. And I can show you a lot of cases like this. So I think that, especially in scoliosis, and I will show a couple, that where the patient would go to the doctor, have years of back pain and deformity, have new onset leg pain, and get a T5 to pelvis fusion for a little problem. So the new technologies are real, they're here to stay, and patients have to be more mindful of who they're seeing for their problem to start with.